Boom, we're in. All right, hi there, hello here. We're going to talk about, I'm going to give it a try, say the name. Ooh, very good. Subluxations. All right, so tonight we're going to talk about what they are, how you get them, how old you have to be to get one, and how they can affect one's health. So a lot of people go to see a chiropractor because, what would be a fill in the blank? Reasons that we see a lot of people. Pain. They're in pain. They have a headache. They have a backache. They have whatever it might be, even different, like a woman just came in who unfortunately is a massage therapist, makes her living from massage, and her ribs get out of alignment, and she gets in a lot of pain from that, from giving them. She's a massage therapist. Anyway, so that's a reason. Low back, we have pregnant women that come in because they have all kinds of things going on. So starting off with the hormonal, and then later on, of course, when the body changes shape, it puts a lot of pressure on the pelvis and SI joints and so forth, and on the ligaments. But pain is a major reason why people come in to see chiropractors. But that's not how the story began. We'll get to that in a minute. We'll talk about how it all began and why. So we're going to talk about what they are, and we'll talk about how you get them, and we'll definitely talk about how they affect one's health. So here we go. It all began 1895. Somebody can figure out how many years ago that was. D.D. Palmer, this big guy with a beard here, and this is a guy named Harvey Lillard. Harvey Lillard was a janitor in the building where D.D. Palmer was. At the time, he was a magnetic healer, did use magnets for healing. And they got to know each other and somehow communicated, and because Harvey was deaf, basically was hard of hearing. And so one day D.D. Palmer said, "Were you born that way? How did it hasten?" "No, actually 17 years ago, I bent over, and when I came back up, I couldn't hear anymore. I heard a pop in my back, and my hearing went away." And D.D. Palmer said, "Well, would you mind, can I check it out, see if I can figure anything out?" D.D. Palmer had a little bit of training with a guy named A.T. Stillwagon, who was the founder of osteopathy. And so he'd had a little bit of training, and he knew something about the body. And so he checked him out, and somewhere in this region of the spine, he found something that just didn't look right, didn't feel right, didn't move the same, and he did the very first chiropractic adjustment. And obviously there would not be a story if what happened that made the story? Restored his hearing. Because if it hadn't restored his hearing, it would have been just somebody thumping on a back, and that would have been it. D.D. Palmer was smart enough to know, okay, I don't think I found the cure to all hearing problems, but I found that there's a connection between that and that. So somehow between the spine and the ear, there was a connection. What would that connection be? A nerve, the nervous system. You get handy dandy spine, would you get big spine in the other room? We had a little spine that the kid broke, so this is all that's left. It just totally did a good job. It was he was very curious and checking it out, and then poof, there we go, handy dandy spine. So, what runs the whole body? What's missing up here?
Brain.
The brain. And the brain sends messages down what? Out to what? Down this way, what's this thing that's inside, encased in bone? The spinal cord. And then the spinal cord sends messages out these yellow, I don't know if they're yellow in the body. They're not, actually. I've seen them on a cadaver, and they're kind of flesh colored. Anyway, in this example, it's yellow, and these are the spinal nerves. And the nerves carry messages to the body. So if my spinal nerves didn't work, I would not be able to wave to you. Obviously, wouldn't be able to talk, wouldn't be able to digest any of that. But because of that, so messages, brain, down the body, down the spinal cord, out the spinal nerves, that's all how it works. And so somewhere in here isn't a direct connection to the ears, but there is a connection to the nerve supply that goes up to the brain. And if that wasn't working right, which in this case it wasn't, and Harvey Lillard had said that he bent forward, heard a pop, came back up, and boom, the ears went, not the lights went out, but the hearing went out. So Dee Palmer was smart enough to know, okay, I didn't find the cure to hearing, but I found something in the spine is connected to how the body functions. So we'll put that right there. We'll come back to that in a minute. All right, so this is interesting. I have a bunch of textbooks that talk about different things. So Grace, would you be willing to read that?
Why did one person get sick while others remain under the same roof, eating the same food and working the same way and remaining healthy? If he could understand why he stayed healthy, he could begin to understand what was missing in the sick person.
Okay, so does that make sense? Questions about that? That really appealed to me. I ran into my very first chiropractor. I had just gone on an LDS mission. I didn't know what I was going to do. I was 21 years old. My sister's working in a chiropractor's office. She said, oh my God, you're going to love this guy. Dr. Paulie's amazing. And you're going to be a chiropractor. And I said, yeah, it's my crazy sister. So in case she's watching, she'd agree. She has blue hair. Just the craziness continues. She's awesome and amazing, but she does come into a room and you say, hey, wonder who the person with blue hair, and that would be my sister. Anyway, so I go to this workshop and I expect it's going to be about bad backs and necks because, like you guys said, people go see a chiropractor because they are in pain. But instead, there was a baby with colic, unhappy baby. All mothers know what colic is. Do you know what colic is? No. Mom, right or left of her, it is, what's colic? A very unhappy baby. By definition, a baby has to cry 3 hours or more without a good reason to be colicky. And you can tell a colicky baby, other than the sound, when you look at the baby and then particularly look at the mom. The mom, you say, okay, something ain't going right here because this mama ain't getting sleep. So anyway, baby with colic, 2-year-old with ear infections, and an older kid with digestive issues. I had no idea what the chiropractor was doing. Never seen an adjustment before, but it was very gentle. The babies didn't mind. The kids didn't mind. The parents liked it. And I said, wow, this is amazing. And I had always kind of wondered, I was actually pretty healthy. I had a sister who was not, and still has to this day is not very healthy, not the same one. This one has normal looking hair. And because had the same parents, raised in the same home, ate relatively the same amount of food, right, same kind of foods, and yet I was uber healthy compared to her. So what was the deal? And I always kind of wondered, so why do some people seem, you know, somebody in your mind, somebody that always gets sick and probably know somebody that never gets sick. So what's the difference? Now, yes, there can be some things lead to obviously good nutrition, all kinds of other things. And yet, even in the same circumstances, there's a difference. So that's what Dee Palmer wanted to know. All right, so here we go. This is what a subluxation is. Here you go, Grace. So this is a nice, happy-looking spine. This are normal. Nerve openings are normal. Nerves are, see, they're still yellow. They're yellow everywhere. And over here, but it can turn red. If you get a subluxation, that's how you know. If you look inside, you see flashing red. No. So how does that look different? Megan, what do you see?
The bones are touching each other.
Okay. So it's moved back, which is not ideal because now it's going to jam up these joints back here. It's over here are nice and happy and they're in the right shape and movement and everything. But now it's jamming that up. It can cause pressure on the disc, can cause pressure on the nerve. Do you think that's going to move better or worse than before? Worse. Not going to move as well. And do you think the muscles are going to be happy about that or not happy? Not happy. So now you have a whole reaction. So in Western medicine, and I'm not anti-medicine, I'm just saying the typical, if you went to a doctor, an MD, and you had a subluxation, what would they do for that? They give you painkillers. They say, okay, you're in pain, or a muscle relaxant. We're going to make the muscles happier, going to get rid of your pain, and that's what they do. Would that help the subluxation? No. It helped temporarily, but it wouldn't take care of the actual problem. So instead, you go to see a chiropractor, and what we do is they say, that doesn't look like it ought to be like that. We think that could move better, could function better if it wasn't subluxated. So that's what we do. All right, so now What are some causes? This is audience participation time. What are some examples of physical ways you could get a subluxation? Lifting something, fall, gravity has an effect on us anyway. Not that anybody would ever sit improperly, but posture things, sitting improperly, sleeping improperly. What else? Other physical reasons. Could be genetic. Some people are blessed with better and worse genetics for their teeth, for their spine, for their heart, for everything. So a lot of physical ways, and a lot of people do come in with a story. They say, oh, I was doing this, boom. Like a guy just came today. He said, I was lifting a propane tank, and I was going up the stairs, and the way for me to turn that way would be to move my leg like that, no stress at all. But instead, he went like that. So boom, boom, got him right down there in the SI joint. So you can be lifting something, moving a certain way. Certain types of work are very physically stress-inducing, and so forth. So lots of causes of physical. How about emotional? You think stress could have any effect on a person's health? As a matter of fact, it can. It's a huge deal. In fact, I'm not going to paint this scenario. In fact, I'll do the opposite. If you think of a lovely place, you're on a beach and there's a nice breeze, kind of like Hawaii, and you feel just, oh, the sun's there, it's warm, you're having a great time. That's a sensation. I could paint the other picture, and your body would start to stress out and start to say, ooh, I don't want to be there. I don't want to be in this cold place, dark, but whatever it is. So emotional stress absolutely can cause all kinds of things. Victoria is a trained emotional code person. Some people come in and we just know pretty quickly, yeah, there's some causes other than just the physical story they told us. There's some other stuff going on. And we all have stuff going on. We have things going on in our families, at work, etc. So, all right, chemical. What about that one? What about how could a chemical something or other cause a subluxation?
Foreign thing in our body.
Foreign thing, our RAS, reticular activating system, says, whoa, I don't like that particular chemical smell, whatever. Some of us are allergic to things. I'm allergic to cats. In fact, if I think about it for long enough, my throat will start to close off and my eyes start to twitch. Anyway, so allergic reactions to things, chemical reactions to things. Some people react to some things more than others. So we know a lot about that example. We know less about these or think less about those. But those are how we could get a subluxation. All right. Next. So here we go. How old do you have to be to get a subluxation? Ooh, quick answer, F. Way to go. All right, so how could you get a subluxation in utero? Exactly. Breech babies are 50% more likely to have hip issues and even a scoliosis. So if they're in that position long enough and their baby and the body and if they're teeny, then if they're peanut sized, doesn't matter what direction they are. But as they get bigger, that absolutely they can also be transverse. They can be head in a tough situation that they come out with torticollis, the neck being super tight, in any kind of direction. Posterior and actually delivery then. So in utero is number one. Number two, the birth of a baby. Can you get our resident baby? If they're not sleeping, I don't want to disturb them, but so baby come in an actual birth situation. We think a lot about the mom, and there's absolutely tons of stress on the mom. Hello, little baby. So big baby. So breech with this way, transverse with this way. You can have posterior. You can have the right way. So, or you can have some combination thereof. We had one baby come in whose arm came out first, which wasn't good for the baby. So anyway, we highly recommend babies get checked as soon after birth as the mom is comfortable bringing them in. I've seen babies within hours of birth, day 1, day 2, 1 week, 2 weeks, 3 weeks, whatever, because the baby coming out, and people think C-sections are easier. There's one major thing that you miss in the C-section. If you go through the vaginal canal, there's a lot of immune system factors that happen. If you go C-section, that's not there. But even to do a C-section, the only way they can get the baby out is they do ultimately grab a hold of the head and pull, because there's no contraction pushing the baby, whereas vaginally, there are contractions actually pushing the baby. So grabbing the head in any which way, turning it, and so forth, birth is a tough, tough time. So under the best of circumstances, birth is amazing and miraculous, but it can be very tough. So that's that one. Yes, all the others are true. You think of, I ask moms that have little kids, like take a 2-year-old toddler, how many times a day does your boy or girl fall? They usually just laugh. So you just laugh because it's innumerable. They just fall all the time. Not even being clumsy, they're just learning how to walk, whatever it is. So yes, this age definitely active. 10-year-olds, boys or girls, adults. So the answer is correct. All the above. Da-da-da. All right, so here we go. We're going to get a little philosophy here. What do you think above, down, inside out means? As far as healing would be concerned. There used to be a college named ADIO. Yes, Megan's ready. She's got an answer.
It's healing from above.
Yep. So healing from above comes down and then goes inside out. So I used to do a little drawing, and I don't have my whiteboard up tonight, but I'd show the difference between, that's fine, Western medicine versus Eastern medicine. Western medicine is, as we already talked about, outside in. You got something wrong, going to give you a pill, going to give you a pain pill, going to give you something to suppress. High blood pressure is going to lower it. Low blood pressure is going to higher it, et cetera. All the symptoms that we do chasing in our society, over-the-counter drugs or actual medication you get from an MD, it's a lot about suppressing the symptom that's bothering you. So it's not necessarily taking care of anything, but it's suppressing it. So that would be called outside in. Inside out, on the other hand, chiropractic's first principle, there's 33 principles of philosophy. The first one is that there's a universal intelligence that has created and helps all matter, and it's continually reacting to how the body, the tree, the flower, the dog, the whatever is acting. So there's this connection, and I call that God coming down. Then inside each one of us, there's an innate intelligence. So I'm not going to do it to anybody, but if I were to cut anybody here, what would your body do? It would bleed, and then it would immediately try to heal. It wouldn't wait. It wouldn't say, if you got cut, it's not going to wait and say, I'm kind of busy. It's 6 o'clock at night. I don't want to heal right now. It immediately goes into healing mode. And that's what our body does. It's healing with inside out. So even if you did get a cut and it was infected, yes, you need to clean it out. Yes, you need to help it. But the Band-Aid's not going to cure it. Neither is the whatever you put on there to clean it out. Hi there. It is going to be the healing from the inside out. And the body would know. How quickly do you think the body would know there was a cut? Instantaneously. In fact, do a little thing right now. Show how smart the body is. Think about your favorite food. I'm going to give you a second. Think about whatever your favorite food is. Think about it being right there. You're ready to eat it. You're seeing what it is. Oh my gosh, I really would love to have whatever it is. Is your body starting to react a little bit? A little saliva in the mouth? So you need the food in front of you, and the body says, yeah, I know, I want that. Please give it to me now. That's how smart we are. So healing does come from all that. We have a saying over there that says the power that made the body heals the body. We really believe that. So one of the big things in chiropractic is to honor the body's healing wisdom. So classic example. Little baby has a fever. We'll say it's a little baby because if it's a teenager, you may want them to have a fever just so they stay in their room for a while. Not anyone present, but a bratty sort of teenager. But if it's a cute little 2-year-old, we'll say a cute little 2-year-old with cute little hair, and she's just so super sweet, and all of a sudden, boom, she gets sick, she gets a fever. So, easy way to think about that, outside in approach to help the baby with the fever, the 2-year-old would be to do what? Give them something. You want to reduce that fever. You want to go after that symptom that's bothering my cute little 2-year-old girl with cute little hair and the cute little smile. So that can be going against that. Do you see that? Because why is the fever usually there in the first place? Yeah, it's the body said, hey, this little 2-year-old has something in their body that we think we need to get rid of, the germ, the virus, the whatever it is. We're going to raise the body temperature to help heal that little baby, that little 2-year-old. So that's innate healing inside. And if you go against that, then you may be messing up the healing process. This is sort of a tough concept, and yet it's one that I very firmly believe in. I have 6 kids. I have 14 grandkids. And luckily for me, I went to chiropractic school before I had any kids. I didn't know any of this, by the way. Before I went to chiropractic school, I had no idea. I didn't really think a lot about health because I was healthy, so I didn't have to worry about it. I was very blessed that way. But I didn't really think about, where does healing come from? How do you do? Should I take this aspirin or shouldn't I? Should I get this shot, this vaccination, this whatever it is? Should I do that or not? I never thought about it. But now that I have, I really, as a father and as a grandfather and as a husband, I've tried to very much honor the innate healing wisdom of the body. Make sense? All right, on we go. This on purpose, you won't be able to read this, so you just have to guess. Give me some reasons why people are in pain, which is still very valid, but are some other reasons why people would want to get adjusted. Sleep better, very good. Some mood, I like that answer, very nice. Immunity helps their immune system. It's a big deal. One very interesting thing, I do a quick segue. We were here during COVID all the way through from 2020 all the way to 21. And we actually increased in visits because we'd done enough educating that a lot of people came in to have their immune system boosted and help. We have that still almost every day. People come in here and say, yeah, I feel a little bit sick. I'd like a little bit of help. So there you go. What are some other reasons?
To be the popular kid.
To be the popular kid. I haven't heard that answer before, but I like that as well. I wish I played tons of sports. I was a jock all through high school and before that. Never got adjusted by a chiropractor after I'd been reamed in football, reamed in rugby, fell out of trees. I wish that I had known about chiropractic because I would have loved to be getting adjusted right away. Other reasons. All kinds of them, actually. Posture can help with posture, to help with your circulation, to help with blood chemistry. There's studies out there that show that blood chemistry actually changes after an adjustment in a favorable way. So that's getting pretty deep inside the body. Lung function, pregnancy, balance, allergy, immunity, blood pressure, vertigo, blood flow to the brain. Anybody want more blood flow to the brain? It's a pretty good idea. Sleep more soundly, etc. So lots and lots of ways. So now we're going to talk about, anybody have any question about that? All makes sense? Digestion is absolutely one of them. In fact, quick story I said I was going to tell. Maybe I told you guys already. Always had heartburn in my teen years and in my 20s. Just was part of my life. So I did the outside in thing, popped my little antacid pill, didn't really worry about it. It calmed it down. I did stay away from spicy foods. I knew certain foods like raw onions or spicy foods, man, I ate that. I was just my tummy was very unhappy. My RAS said, that was a bad idea. You should not have had that. But I just did. That was just part of my life. No big deal. That's life. I just take my antacid and on I go. So I go to chiropractic school in my early 20s, never been adjusted, didn't know really what it all was about. Just appealed to me, the why thing. I started to get adjusted at the student clinic, and after a couple of weeks, I said to the chiropractor, I said, this may be a really stupid question, but I'm not taking my antacid tablets anymore because I don't need them anymore. Is there something you could be doing that could help this? Because I don't know anything else is different. He said, duh. Oh, you're stupid. No, I don't know if he said that or not. He might have. He was upper class and wise guy. Anyway, so sure enough, all of a sudden my brain and my stomach communicated better because I'd gotten rid of that interference at subluxation. The digestion absolutely is a biggie. Menstrual cycles is another biggie. Can help women either have better or easier ones, or actually even fertility. Men and women have come to chiropractors to help increase their fertility because, again, there was some communication error in the body. Okay, this is where my heart is. I already told you a couple of these. Reasons why a baby or a child should get adjusted. There's answers up there already. Colic we already talked about. Constipation, difficult sleeping, sinus congestion, ear infections, bedwetting, reflux, increased nervous system, and immune system function. I'm going to talk about this one just for a second. I have so many stories about ear infections. Probably literally in 40 years have hundreds to thousands of them, but I'll tell one. A woman came in to see me as a friend of mine, had gotten pregnant and came through her pregnancy, then didn't come in for a while. Brought in 2-year-old Sam to my office, and 2-year-old Sam had been having ear infections for about a whole year. She said, we've done the normal stuff. We did the antibiotics. They want to do steroids. They want to do tubes in the ears. I really just don't want to do that. He seems to always have sinus stuff, always have ear infections. I thought I remembered you saying something that you might be able to do to help. I said, great, let's check him out. And I had to check to see if he had a bone. And lo and behold, he did, particularly in the neck. Part of the way the body works, the structure of the spine, the nerves here go up to here. The nerves in here go around here. Nerves here go here, and they go down. So in his neck, major subluxation. I don't remember all the history because it's quite a while ago, but some things that happened and his neck was definitely way more jacked up, professional term there, than normal. So worked on the subluxations, taught the mom how to do sinus drainage, and within 1 month, first time in Sam's life, he was free of ear infections, and I knew them for the next 10 years before I moved away and didn't have any more problems. So that, I have so many of those kind of stories. We have reflex stories. Had a projectile vomiter come into the office. I thought the mom was exaggerating. Poor mom had this huge bag. I was going to look for a bag, but just this big bag. She was a BYU wife of a student, early 20s, first kid. And I said, what's the deal with the big bag? And she said, 3 changes of clothes for me and 3 changes of clothes for the kid. I said, so it's that bad? She said, oh yeah, it's projectile. I said, yeah. In my brain, I said, yeah, I don't know. She's exaggerating. But then he was willing to demonstrate for me as if on cue, and boom, I said, okay, yeah, you need to need that big bag. Within a month, no more reflex, no more projectile, anything, because all of a sudden the body started to work better. So almost done here. Whoops, that was it. So in review, we'll go back to boom, 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 right there. So what chiropractic is all about is, yes, a person can absolutely come in because they're in pain or discomfort, and we welcome that. We'd much rather have people do that than take a pain pill, take a muscle relaxant, whatever. But a subluxation can affect anybody from in utero. I don't know how to adjust in utero. We do have some techniques that helps the ligaments on the outside, not the baby on the inside directly. And babies and all the ages in between. And I have found it to be a major way to help somebody be healthier in a very natural way, help the body function better, and therefore need a lot less outside things. The statistics across, lots and lots of them, about how much chiropractic saves in surgery costs, in days lost from work costs, et cetera, because the body's functioning better. So what we offer when people come to the class is, if you know of anybody that you can think of who should get checked to come in to see if they do have subluxations, they can be of any age. We offer to anybody that comes, they personally, or they can refer anybody in to get an exam at no charge. So we offer that because we're just saying, is it likely that they do have a subluxation? If we do find one, we tell them about it, and they can decide if they want to do something about it or not. But I'm thrilled. I've been doing that stuff for over 40 years, and chiropractic kind of found me, and I've seen so many miracles in so many people's lives because it helps the body function better. So, anybody have any questions? Megan's thinking of something. That's good.
I just feel like a lot of the healing is coming just because you're decreasing the inflammation that comes from stress.
Sure.
So you can get a subluxation because your muscles are so tight.
Yep.
And it's just pulling your spine out of place.
Yep.
But once you're able to decrease that stress, then that's what's, I mean, I'm thinking about an ear infection or tonsillectomy or even getting a cold. Like, how does an adjustment help you from getting a cold? It's more about like the inflammatory response.
Yeah, I would say both. I would say you're absolutely right. I always want to know a cause. When anybody comes in here, I'll tell you a classic, simple, easy, stupid sort of example. I've been in practice a little while. A guy comes in, very fit, kind of like the perfect looking male, just was all put together great, dressed great, everything else. He said, I got two problems. My neck is always sore and my one shoulder bugs me all the time. So I asked him all kinds of questions, physical, chemical, emotional. And the final question I said, because I was early in practice, I said, so I'm just curious, how do you sleep? He said, well, I sleep on my stomach with my arm like that. And I started to laugh. And I said, sorry, that was rude of me to laugh. He says, oh, you think? I said, yeah, I think. So I could have adjusted him up and down and all around, but we never would have changed the cause. And therefore, the effect would have always been there. Even we could have minimized it or decreased it some, but the cause was still there. So yes, there you go. So absolutely, emotionally with stress, nutritionally, you're a nutrition expert. If you continue to abuse your body nutritionally, your body will not ever be happy about that. You may decrease it by doing other things, including adjusting or whatever. But yeah, the cause is still there. I told one guy that came to see me, this is my practice in Maine, he came in and said he had severe headaches. And so on my form, I said, do you smoke? Do you drink? Do you drink coffee? And so I put how much? And so next to coffee, he said 2. I said, 2 cups a day, it's not terrible. That's, he said, no, 2 pots of coffee a day. I said, dude, I literally did. I won't tell you his name, but I looked at him and I said, if you're going to drink 2 pots of coffee a day, you want me to get rid of your headache? I don't think I can help you. I mean, I didn't even do the exam yet. I hadn't even touched it. I said, I don't care what your spine feels like, but if you're doing that, then I'm sorry. That's just, I don't know. It probably is a waste of your time and money. He said, no, I can do something, whatever. And he was a funny guy. And he said, no, let's go ahead and do the exam, do the x-rays. We found subluxations. The next day at work, he said, was at work, he had a huge thing of coffee, not quite this big, but a big thing of coffee, and he spilled it. He said, I figured that was a sign. So anyway, he stops drinking coffee, starts getting adjusted. He actually had the beginning stages of macular degeneration, which is a black hole opening up in your eyeball, and you can go blind from it. My mother-in-law did. And it reversed, and he went to the ophthalmologist, and the ophthalmologist said, what are you doing? He said, well, I'm going to a chiropractor. He said, well, it's clearly not that. It's got to be something else. And maybe decreasing the coffee, I don't know. But anyway, yes. So we are very interested in cause and effect, as well as trying to help the subluxations. So any other questions? Awesome. Well, thank you guys for coming. Appreciate it. Goodbye to you. Goodbye to you. Appreciate you guys.